George Lawson. I'm the Director of Transplant at Ochsner Foundation Hospital in New Orleans, Louisiana. Well, as Director of the program, I'm responsible for the overall performance of the program, but I'm by training a transplant surgeon, so that's what I love to do. But certainly every aspect of the program, everything from patient satisfaction when they hit the door to making sure that all of our reports are into UNOS, all that is ultimately my responsibility. What makes us a little bit different than everybody else is, I think, the commitment that we have to not only having excellent outcomes, but to patient satisfaction. It's something I mentioned is my responsibility. One of the first things I was responsible for. It's a focus of ours. I think a lot of different institutions are trying to do that, but we're very successful at it. Something about the people who are committed to transplant, it's not just a job, it's not just what they love to do, it's almost a mission, it's a calling. And the people who are involved with transplant stay involved with it for a long, long time. Our team is got over 100 years of experience in with our nurses, and almost all that experience was achieved here at Ochsner Clinic. If you look at the people that we work with, the place that we have to work in, the environment that we work in, it's one that is team-oriented. It is one where everyone has a role, everyone has a voice, and you know that you can directly affect people's and families' lives. And when you have that as the baseline, when you have that as the endpoint, it's really thrilling, and I think that's what sets us apart. But most of we have great people. The people that walk into the room that serve you that food, the people that come in and make sure your room is clean, the people that come in and ask you if you need anything at all, from whoever sweeps the floor to who helps you out of the bed, who's checking your vital signs, to the doctor who's making sure that you're doing well clinically. Everybody who walks in that room is interested in your well-being, not just your health, but your well-being. Is everything okay? What else can we do for you today? And that's our focus, and that really does set us apart. Other things that set us apart, I think, that are important for someone who's searching for a place to get transplanted is that we have a very, very short waiting time. One of the shortest waiting times for liver transplant in the entire United States. Right now, our median waiting time for 2007 was 31 days. The national average is nearly 20 months. That's a huge difference. We have a lot of organs that are donated within our states. We have very nice and kind and giving populace in Louisiana. And two, we import livers from other states. And I don't want to talk about livers as a commodity, but we have local livers and we have livers from outside our state. And livers outside the state we bring in, we brought in 30 livers from outside the state last year, which accounted for 30% of our transplants. We don't use bad livers. We use good livers with bad stories. There are some donors that have a bad story, and some surgeons won't go look at that liver, especially if they have a full day the next day. But we just transplant. I don't have a whole list of general surgery cases I'm doing tomorrow. If I'm not transplanting, then I'm not doing anything. And if I'm not doing anything, then my patients are suffering on the list, and they may be dying on the list. So when I have an option to go out and look at a liver that may have a bad story, if I think it might be good, then we go look at it. Because with our eyes, looking at that liver, with our hands touching that liver, when we take a piece of it and look at it in the microscope, those things tell us whether the liver is going to work or not the story. The story is always incomplete. The story is never enough to say no. At our institution, we have dedicated OR staff, technicians and nurses, a group of dedicated transplant physicians and transplant anesthesiologists who care for the patients when they come into the room. We are never pushed back from doing our transplant because of another case in the hospital, whether it's be a trauma or a heart attack or emergency cabbage. That's not our team. Our team is a liver team, and we do a liver transplant as an urgent case. So one way we're able to use livers that other people can't use is that we get them in very, very quickly. More than 90% of the time, our livers that we take are on ice for less than 5 hours. The national average is about 35%. The only thing that I can do as a transplant surgeon to improve the chances of that liver working when I put it in is to have it on ice for a very short time. And we do that consistently, better than most places, if not probably than the top 5% in the country. One measure of whether or not we are doing well is to look at our patient survival and how many livers that we use don't work. Well, for us, over the last 2.5 years, we've lost a liver to non-function. That is, it didn't work right away, only once, for less than 0.5%. Nationally, it's about 2 to 7%, depending on which statistics you believe. So our livers that we're using are working. If you look at patient survival for 30 days, which would be a lot of judgment issues, are you picking the right patients? Are you picking the right donors? Are you picking the right donor livers for the right patients? That combination, which is important. Nationally, it's about 94 to 96 1-month survival. Our 1-month survival for the last 2.5 years has been greater than 99%. 1-year survival nationally, 84 to 87%, depending on where you fall in. For us, over the last 2.5 years, it's been over 95%.